Hi, it's Dr. William. Let me talk to you about having a tummy tuck with a previous C-section. And this is pretty common because a lot of patients who have children that end up developing excess skin that makes them want to have a tummy tuck to remove that, to get the flat abdomen and get rid of the skin, will sometimes ask me, what about the C-section scar, or is it possible to do a tummy tuck with a C-section? And the answer is yes. I would say probably more times than not, when we're doing a tummy tuck, we're also doing it in the setting of a C-section scar. So let me just explain to you how that kind of works. So when we do a tummy tuck, the incision is low. It's usually placed in the lowest crease where people bend, and there's usually a natural crease that's there, and that's where we make the incision in that crease. And sometimes the C-section scar, the obstetrician will have made that C-section scar right in that same area. So that's pretty easy to remove that scar because I just lower when I go through that central part and remove that scar. So if you imagine that somebody here has a C-section scar, they're usually a little bit more horizontal, and they're down in that upper mons area. Then what I'll do is I'll find, let's say the crease is running in this area, and that's the natural area where we're going to put the scar for the tummy tuck. Then I'll just drop the incision just a hair lower in that central area, and that will allow me to remove that tummy tuck scar, and then the rest of the scar just goes back up into that crease. And so then you get a nice low scar and you don't have the C-section scar anymore. That's the most common way. Sometimes, occasionally, we'll see, in fact, I just saw somebody this week who had a very low scar for their C-section. So it was very low, and it can be difficult to make your incision for the tummy tuck down that low, because what can happen is if I dive down here to pick up that scar, it can either give me two problems. One, it increases this distance from we usually try to make the incision above the belly button, and it will increase that distance. Instead of being where I would normally make the scar, if I've got to go down a lot further to get that very low C-section scar, that's that green line, then it increases this distance so much that I'm unable to remove all of that skin. And then patients will end up with, in addition to the traditional horizontal scar, you can also end up with a small vertical scar here, because unable to take all of that tissue, and I have to bring this area here, this amount of tissue that I remove, I have to lower that line. Well, the reason you get the vertical scar here in this area is because in order to give you the new belly button and in order to remove the skin, I have to make an incision around the belly button. And when I do that, and if I'm only removing the skin from here down, then there's an opening there, and I have to close that opening. And so when I take this tissue, this line, and move it down here, I then have to close that incision that I've made around the belly button, and that's where you get the vertical scar from. So sometimes I can do it, and it ends up with a vertical scar. Other times I can do it, and you don't need a vertical scar because I'm still able to take all of that tissue. But occasionally, when the scar is very low in this area, if I were to make my incision for the tummy tuck down low in this area here, what happens is this lower scar from the C-section is just too close to where the vaginal opening is and where the labia are. And so by removing that scar and removing the skin, it'll distort the labia and the vaginal introitus, and it'll pull it up too much, and it'll really give you a bad result. So removing the scar when it's in a traditional normal location, not an issue at all. Occasionally, if there's enough skin, or if I need to make a small vertical scar and it's not going to distort the introitus or the labia, then I can do that. But if I feel that that scar is just too low, so I'm removing too much of the mons, that can distort the vaginal labia and introitus. So what I do is I will make the scar, I'll have to leave that the C-section scar and perform the surgery like I normally would, and you'll end up with two scars. You'll end up with that original C-section scar in that very low position, and then you'll end up with a new tummy tuck scar in the traditional sort of regular location where you bend. So that's the reason for the scar, for the incision on the outside. Now, sometimes people are worried not just about the scar from their C-section on the outside, but they're concerned that having the C-section will impact their tummy tuck. Now, there is scarring from a C-section that occurs inside the body as well, and we encounter that frequently because a lot of patients that we're doing tummy tucks on have had previous C-section. But that scar really doesn't affect anything. That scar tissue that's below where the outside scar is doesn't really affect anything. What we do is we go in, and let's say, for example, now we're using this example where here's a C-section scar and here's where our tummy tuck incision is, and I'm making it a little bit lower just to remove that C-section scar. Then when I go in and I start going down, because remember, we're going to go through the skin, through the fat, down to the abdominal wall, and when I do that, then I'll encounter some of that scar tissue, and it's just variable from patient to patient as to how much scar tissue they have, but it doesn't really affect things. I just go down, I go through that scar tissue, and I get to where I need to go, which is that muscle plane right above the muscle. And so I'll remove that internal scarring with the skin and the fat, normally like we would do to remove that skin and fat when we're doing the tummy tuck. That's a whole point of the tummy tuck. So that scar tissue that's inside doesn't really affect us, doesn't really bother us, and it just gets removed during the tummy tuck. So having a C-section doesn't affect us doing a tummy tuck. It's very common because of the frequency of which C-sections are performed nowadays, and it really doesn't change very much about doing a tummy tuck. That internal scar tissue really doesn't bother us, and we can usually, most cases, remove that C-section scar, so that scar is gone, and you're only left with a new tummy tuck scar.